Hello, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa, and I partner with them to bring you an easy and educational workday session. Today's session is injury prevention and resilience for active adults. You're going to learn how to prevent common sports-related injuries and enhance your performance through a dynamic warm-up routine, simple daily strengthening and stretching exercises, and proper body mechanics. So a little bit about me. I have a doctorate in physical therapy. I'm owner and founder of PAR5 Physical Therapy here in Randolph, New Jersey. And I got my doctorate from Mercy College in upstate New York in Ardsley, Dobbs Ferry, I guess. And I also have a BS in exercise physiology from Rutgers University. I'm also a board certified orthopedic clinical specialist and a Titleist Performance Institute certified golf medical professional. So let's get into it here. Pull up my slides, transition into that. So injury prevention and resilience for active adults. Now, just because I'm a medical professional, if you've been to any of my talks before, you're probably familiar with this slide. If you're dealing with anything specific, make sure that you get a thorough physical examination by a medical professional so that you can understand what the root causes of your problem is. And you know, the stuff that we're going to talk about today is aimed at a broad population. So some of it you may be able to do, some of it you may not be able to do. But if there is pain or discomfort with anything that we're going to do today, make sure that you pay attention, listen to your body, and then go and have that checked out. Alrighty. So as far as the human body, and if we take, you know, I guess 7.5 years of education and wind it up or summarize it in one slide, it's this: that your body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. So if we're thinking about trying to avoid injuries, we have to look at how people move and how joints move, and if segments of your body are performing what they're supposed to do. If you want to prevent ankle sprains, right, you want to make sure that your ankle is as mobile as possible. It's one of those mobile segments here, right? And if we want to reduce, like, say, knee pain, we want to make sure it's stable, that the knee doesn't kind of get wonky or rotate too much. All it does is a very simple joint. All it does is just bend and straighten. So you want to make sure that it's stable, that it does is just that motion. If the ankle starts to get stiff or loses its mobility and becomes a stable segment, your body then goes through this compensatory strategy that it starts to make up what it lost in one segment and try and make it up in another segment. So for example, if your ankle is tight, then your knee might become more mobile or less stable, and then we've got knee problems. But I would say this, is that what I see most when people get tight with the ankle, or their ankle is limited with their mobility, the foot becomes unstable. We see people get flat feet, flat arches, they start to develop a bunion. It's actually your foot becoming unstable and creating like a second joint in your foot, becoming loose in the ligaments to compensate for a tight ankle. So that's one of the things, and one of the examples of how this alternating pattern of mobility stability kind of plays with how our body functions. Now, if you're involved in sport or athletics, or you like to play golf or play pickleball or play tennis or go for runs, oftentimes I say this to a lot of my clients, that your sport is not necessarily your form of exercise. Although you might get your heart rate up when you play tennis, pickleball, golf, or whatever, it's not a form of exercise, because exercise is more structured. And what I mean by that, we look at this hierarchy, this pyramid here, the hierarchy of movement. To get to the top, where we look at your sport, which requires skill, we have to make sure that the bottom rungs, or the base, is as full and as good as possible. So we can't have skill or sport without power or speed, and then strength and stability. We can't have strength and stability. We can't have power and speed without strength or stability. And we need to have some tissue extensibility, flexibility, joint range of motion, joint mobility, all of the bottom stuff to be able to produce the top stuff. All right, so say, for example, pickleball, tennis, golf, all those things, and your body just is focused on accomplishing the task at hand, right? And this goes for like daily activities as well. Getting up out of the chair, bending down to pick up something off the floor, or even just reaching up into a cabinet. When your body is focused on a task or a sport or whatever, it will accomplish that task and perform that movement with the least amount of energy. It seeks that path of least resistance. So if you are lacking some of these lower rungs here, if you're tight, lose range of motion, or don't have enough strength in a certain body muscle, a body part or muscle, your body just compensates or works around that. Says, all right, so I will not use that muscle and I'll substitute another thing, or I'll move a certain way to accomplish that task. So if you're playing tennis, trying to hit that ball, hit that overhead or that serve, or hit that golf ball, or with any other sport, you're very focused on that. And your technique and way that you move to accomplish that task and the amount of skill and sport, your ability to perform at that sport, your performance really plays on how well you are at these lower rungs, okay? So what we wanna go over today is a dynamic warm-up, and the dynamic warm-up is similar to dynamic stretching. Now stretching, I've had other classes in the past talk about what is stretching, what is static stretching, and what is dynamic stretching. Static stretching is when a traditional stretch where you're holding it, you're moving a muscle, lengthening it, and you're holding it for 30 seconds, 20 or 30 seconds. 30 seconds is the prescribed perfect amount of time to hold a stretch, to lengthen that muscle. That's a static stretch. And dynamic stretch is taking a muscle through its range of motion, lengthening it and shortening it, without holding any one position. One is good prior to activity or exercise, and one is good after. We never want to perform static stretching prior to exercise, prior to working out, because a muscle that is stretched and held for a prolonged amount of time loses its strength temporarily and cannot create the amount of tension that you may need for your exercise, for your sport, etc. All right, daily stretches, things like simple things that you can do within 2 to 3 minutes daily to maintain physiological normal range of motion in your joints. Okay, it's very similar to your vehicle, your car, any complex machine that you want to maintain, have it run smoothly for years to come. Your body's the same thing. It's much more complex. We want to be able to have some type of maintenance program to maintain proper normal physiological ranges of motion. And then strengthening exercises. Strengthening your muscles are basically your joint armor. If we don't have strength around joints or in the ability to move and control joints through their normal range of motion, then we have movement dysfunctions. We have this recipe for injury or aches or pains, or why things feel tight, why things feel bad after an activity. So we want to make sure that we include some type of strengthening. And strengthening can be different things, it can mean different things to different people. And that depends upon your level of activity, fitness level, health, whatever. Strength doesn't mean that you don't pick up a weight. You can do body weight training and use your own body weight as a resistance, as an effort, especially if you do exercises correctly to target the correct muscles, especially the weak ones. Like I said before, if you try and target a weak muscle, your body's like, nah, I'll just use another muscle. So you want to make sure that you're doing these exercises with proper technique to attack and target the correct muscle. But oftentimes people will come in and, especially like, they've been instructed by their physician to never squat or never pick up something off the floor, don't bend over or something like that, especially after surgery. What happens is that we learn how to do those things in a completely different way. We lose the ability for normal range of motion. Even after surgery, you want to preserve as much normal physiological range of motion as possible. So there are ways for improving motion or being able to bend over without using your back, using bigger muscles, bigger joints to protect joints and reduce the amount of wear and tear, right? Or reduce the progression of arthritis. If you're over 40, everybody over the age of 40 has some type of arthritis. And then also we talk about body mechanics. So that leads us into the body mechanics. All right. So let's pull up my wide camera angle and let's see what we can do. I mean, when talking about this this whole programming of dynamic stretching, right? So how can we prepare for exercise or prepare for activity with dynamic stretching? So what I like to do is work from the bigger muscles, working the hips and the core and the shoulders and the shoulder girdle. So I have a little chair, and you could do this holding on to a table, chair or whatever, wall, doesn't matter. We can start with the leg swing. And the leg swing is just really nice and easy, just swinging the leg forward and backward. Now, as we're doing this, we want to make sure that we're doing it properly, activating and lengthening the hamstring when the leg goes in front, and then activating the glute muscle and stretching the hip flexor here as the leg goes behind. So as I do that, that motion, depending upon how flexible you are, may look different. It might not look as big as this. It might just be down here. Because one of the things that we want to avoid is compensating through a different muscle or different joint. Like this motion is completely different than this. I'm keeping my trunk still. My ribs and my pelvis haven't changed their relationship in terms of distance. They're not opening or closing, right? So this is a leg swing, and you can do this like 5 to 10 times or 30 seconds, and that'll be a good little warm up for the hip flexor and the hamstring group. And then we could go into the shoulders, where we kind of just simple. You could do this sitting, you could do this standing, just reaching up and focusing on full range of motion, and then making big circles. Pretty simple, right? So we can go around, and the big thing here is as we're going through this big circle, we're not, again, changing the relationship of where my pelvis and my rib cage are. So as I come up, if I'm making this big circle and I'm trying to reach this back corner here, I do not want my ribs to separate or open in the front and arch my back. So I want to try and make sure that that stays stable, and I'm just making that circle through my shoulder, and I can make it the other way around, right? So as we did with the leg swing and the legs, we could do arm swings, circles, backwards, forwards, clockwise, counterclockwise, about 30 seconds each, super simple. And then once we're kind of loosened up, and then we can kind of get onto the floor for what is known as the world's greatest stretch, because I think it's called the world's greatest stretch because it addresses a lot of joints and a lot of things. So the world's greatest stretch is done on the floor in a long lunge position. You basically take the heel and the back knee and try and separate it as much as possible, right? And both hands are going to go on the ground. And what you can start off with is bringing the pelvis forward and then bringing the pelvis backwards. And as I do this, again, similar to what the dynamic leg swing and the arm swings were like, I'm not holding any one position. Let me show you on the other side here. On the other leg, it's hands down, my hands don't move, my foot doesn't move, and I take my leg back, or take my hips back, take my hips forward. So this is the beginning of the world's greatest stretch, but there's also an upper body thoracic spine component when we hold this position, and I take the same side hand, my left foot's in front, my left hand is going to do this, and reach up to the ceiling, and then reach down and through my other hand to try and get my elbow to the floor. And then up, taking a deep breath in as I open up my torso, my lungs, and then exhaling as I go down and rotating around. And again, it's a dynamic stretch. I'm not holding that one position. So again, you could do this other side, same thing, rotating through, trying to get as close to the ground as possible when we're going down, and then rotating around. World's greatest stretch. All right. And then what I like to do, I mentioned the calf or the ankle before, and I think for a lot of people, because we spend our time sitting so much and not getting into a position of what we call dorsiflexion, right? My ankle coming up this way, we tend to lose that ability for dorsiflexion. And if we lose that ability to move in this direction or this position with the ankle, that can cause the knee issues. So I like to take something. You could roll up a towel, get a textbook, get a wood block, it doesn't matter. As long as the front part of your foot is elevated, keep your heel down, and then we can kind of simply just rock forward and backward. Hips go forward, my knee is straight, and I get this stretch into the calf, right? So again, dynamic stretch type of move, going in and out of that lengthened position. Important that the pelvis come forward and my knee does not bend. All right, so that's option one. The option two for that is to do it with the knee only. And there's two muscles in the calf that connect to the Achilles tendon, that tendon in the back of the heel. And this is the reason why we do this with two different positions of the knee. Knee straight, right, coming forward, and then knee bent, coming forward. Now, from the front view, which is very important, because a lot of times with tightness of the ankle, this movement right here will be offline. So oftentimes people will set up with their foot like this, and with the foot turned out, what happens is that creates an unstable foot structure and unlocks the ankle, and then I can come in and be like, yeah, I don't feel anything, I don't really feel anything. And even with the knee straight or the knee bent, I could bend the knee and my foot is turned out. That's a different joint position. I want to make sure that my foot is completely straight and that my thigh, especially when I start to bend this knee, points forward. It doesn't do this, which everybody does if they have a tight ankle. The foot points one direction and the knee points in the other. We want to preserve that knee joint as much as possible. We can't facilitate or reinforce this direction. You have to facilitate the knee outward. I know it's tough to see with the black pants, but basically the knee has to find the same direction as your foot. If you look down, if your foot is totally straight, your thigh, your hip, and your knee, your thigh should be pointing in the same direction as you do that. All right, so 30 seconds each leg. That's your ankle thing. And then we could talk about squatting. And squatting, I think, is one of the key exercises that should be done for everybody, regardless if your doctor says no, you should not squat. Because if your physician, even after like a knee surgery or something like that, if your doctor has ever said to you, you shouldn't squat again, then you should never sit again. All right, because getting up out of a chair and sitting down is a squat. And this is a strengthening exercise if done correctly. Now, from the front view, just like what we said with the ankle and the knee, the foot needs to be relatively straight. You could turn it out a little bit, but it can't be like out like 30, 30 degrees. You know, it has to be relatively straight and probably straighter than what you think you are at. And when I put it railroad straight, most people say that feels weird. That feels like my foot is turned in. But, you know, if you go like maybe 5 or 10 degrees off, that's okay. The more important thing is where do the knees go? If you're doing this in front of a mirror and I sit down in a chair and my knees do that, that's a fail. And you think about how many times you sit down and stand up per day. Every time that your knee goes in, that wears out that joint more, creates more stress on that joint surface. And then it's a question of not if you have knee pain or if you need knee surgery, but when. So the big thing is keeping the knees in line with where your feet are pointing as you stand up. And it may feel really weird to you because this movement pattern is totally unfamiliar, because for most people, for years, they're used to getting up like this, right? And because we get up like this without thinking, again, this is the path of least resistance. It takes more muscle energy more glute and hip strength to do this sit to stand squat motion with the feet flat and the knees pointing in this direction. All right, so there's the squat. Knees got to be pointing out. That activates the hips more. And if we talk about, body mechanics, bending and picking up from the floor, this is something that you might not even think about, and you just do second nature. I'm going to pick this ball up or pick something up, laundry basket off the floor. We just kind of do one of these and then stand up, right? I can keep my legs straight and then just bend down. But similar to the other things that we talked about when I'm doing these leg swings or the arm swings, if this relationship of where this rib is and where this pelvis is, if that relationship or that distance changes, if it extends or opens, or it flexes or it closes, those are not good. Our spine, lumbar spine, in that alternating pattern of stability and mobility, the lumbar spine needs to be stable. So when we're moving and bending and trying to pick something up, especially under load, that has to be straight. Now, straight doesn't mean vertical, right? Picking something up in this way, I'm going to keep my back straight, and then all of a sudden my heels come up, and then what happens? My knees crack, and that's way too much stress on my knee. What we want to do is maintain good spine stability, back stays straight, and my feet stay flat. Feet flat is a much more stable surface to push from or control from. And then we hinge at the hip. My hip does most of the bending here, and my knees bend, but not as much as a squat does. And I can get into this position to pick up a weight without changing the angle of my back, right? So mechanic-wise, when we say, hey, keep your back straight, use your legs, this is what we mean. Using the hips, which is a larger, stronger muscle than their thighs, and using the hip joint, which is a larger and more durable joint than the knee. So keeping your back straight doesn't mean picking something up like this, all right? It can mean like this as we go down. Being stronger. Again, you need to build strength to get into that position. Oftentimes people have no idea how to do this because they default to the movement pattern that creates the most amount of stress in the muscle, and they just do this and they start to bring their knees forward, and then they run out of room at the ankle, and all of a sudden they get to this position where their heels are off the ground and they're squatting down like this. So movements throughout the day that you don't pay attention to, you are typically a movement pattern that we're so used to doing, where our body moves through this path of least resistance and creates these dysfunctions that can increase our risk when we start to play games, play sport. When we're focused on something else, trying to attack that ball or beat our opponent, our body moves in a faulty way, and then we create stress and strain on different areas. So make sure that you pay attention, let me pull this up, to what we talked about with our body, alternating pattern of stability and mobility, and also the hierarchy of motion in our other slide, our triangle slide, our pyramid slide, movement. Pyramid of movement, movement pyramid. All righty. So I'm going to check out the chat, see if there's any questions for me. 30-second countdown, and then we'll close it up for today, and then let everyone enjoy your Wednesday. All right. So no other questions? All right. Thank you for joining me today. You can look for this session and many more on demand in any of the Better Spaces apps. I will be back Tuesday, October 24th with how to get rid of low back pain. We're going to find out the 3 most effective tips to relieve lower back pain and prevent it from flaring up. Number 1 might surprise you. All right. Any questions, you could email me at paul@par5pt.com or team@betterspaces.com. Thank you for coming, and be well.